Good morning again. There is second part for our presentation today. Now we will discuss the clinical picture of addiction. And the clinical picture of addiction will be divided into two main parts. The first part is clinical picture of general addiction and all types of addiction. And the second part will be the clinical picture of specific drug addiction. According to DSM-5 criteria, Diagnostic and Statistical Manual number version 5, we have substance use disorder and we have substance-induced disorder. Substance use disorder, which is simple addiction, which is dependence, and this criteria will be discussed later. But substance-induced disorder, it means that addiction itself or using the drug leading to development of another condition, which is substance intoxication, substance withdrawal, substance-induced delirium, substance-induced persistent dementia, substance-induced persistent amnestic disorder, substance-induced psychotic disorder like schizophrenia and other, substance-induced mood disorder like mania or depression, substance-induced anxiety disorder, substance-induced sexual dysfunction like impotence or erectile dysfunction, and substance-induced sleep disorder. So substance use is not simple condition. It can be only substance use condition, it's called dependence, or this substance could be the cause for any psychiatric disorder and sometimes many medical disorder, and the main cause will be substance. So we have to know what is substance or what is the criteria of substance dependence. We have 11 criteria for substance dependence. First, a minimal 2 or 3 of this, it's called minimal or mild substance use disorder, which was in last version called abuse, while 4 to 5 lead to what is called the moderate substance dependence. 6 to 7 it's called severe dependence in last 12 months. So I have to fulfill this criteria for 12 months, and this criteria according to number of items which is present, it lead to the severity of substance use. First of these, taking substance in larger amount for larger periods than it was intended, want to take or to cut off or to stop the substance but he cannot manage, spending a lot of time of using recovery from substance use, craving and the urge to substance use, not managing to do what should be at work, at school, at home, continues, and even there is a problem in social relation with his spouse or other, give up an important social and occupational recreational activity because he is taking substance, so he cannot participate in sport or going with his friend to club or something. Using substance again and again, even it is put him in dangers. Also he taking drug and he feels he is going to die by overdose, for example, but he continue using this drug again and again, continue to use the drug, and even he knows that he have physical and psychological problem with using the drug. The need for more substance to use to get more effect, which is called tolerance, and development and for withdrawal symptom, which can be relieved by taking more substance use. Dependence could be psychological and could be physical. Psychological dependence, which is called habituation, which is characterized by continued using of drug and habituation for use of the drug. Psychological, it means that body don't feel physical symptoms if he stop taking the drug, but he feel depressed, anxious, irritable, and so he continue to use the drug again and again. Physical dependence is characterized by withdrawal, as we say, sudden stoppage or cessation or decreasing amount of the substance after prolonged use, leading to what is called substance specific syndrome, which is specific to each substance use. Tolerance, which is need for increase or the amount of substance to achieve the desired effect, or the same amount of the drug cannot give the desired effect. We have universal symptom of the drug. People who are addict, if you see from the street, from outside, you find that he have symptom in his eye, his nose, his mouth. Sometimes the eye is feel blood shots like in the eye. Nose may be bleeding. He have cough and he has irritation of mouth because he taking the drug either by nose or by drinking. Sometimes you will find that weight changes. You will find that people taking drug either weight loss for much weight loss in short period or even weight gain. Withdrawal symptoms, which is find that people changing in mood rapidly in very short period, sometimes headache, irritability, anxious, and within minutes he will be changed normally again. So it is like withdrawal symptoms which be relieved by taking the drug again. Poor hygiene, people who is taking drug usually don't take enough food, then take enough healthy food, and so they have poor hygiene. Skin may be having area for injection, having flushed area, and we have signs for taking drugs or other behaviors that these people may be shaking, tics-like movement, abnormality in the face and the arm. All these giving you an idea that these people may be addicting to a drug. Drug can be divided into two main groups. One is depressant drug, one is stimulant drug. Depressant drug, this drug giving slow message to the brain and so decreasing all activity of the brain, so the heart rate will be dropped, the body temperature will be dropped, the respiration will be dropped, and muscle will be slow, arm will be slow, and the result the body cannot doing the very rapid reflex, and which making them in danger if he's facing and dangers in part. And these people will be seen as lazy in walking, in speaking, and doing everything. On the other hand, drugs that is stimulant that giving and stimulating message to the brain, so increasing the blood supply to the brain, to the skin, to the body, and the heart will be speed on, the blood pressure will increase, the liver will release the sugar to the blood, and leading to more activity and more activity. It is like you feel stressed, and the people will be anxious, irritable, don't sleep, and doing much more activity. So these are two main groups of substance generally. If we take drug by drug, we have, for example, opiates including heroin, morphine, methadone, and usually taken by smoking, snoring, or subcutaneous or even intravenous injection. And the effect is pleasurable effect, rapid pleasurable effect. The negative effect is dependence, which characterized by meiosis, which is narrowing of the pupil, tremors of the hand, impotence, and usually 2 to 3% of people is usually dying by using much dose or over toxicity. There is high risk for infection and cross-infection like HIV and hepatitis B by blood transmission. Overdoses is manifested by meiosis, respiratory depression, and death. Dependence is very common, and dependence and tolerance is very rapidly to developed. It have to be maintained and treated to decrease its risk and to be treated. On the other hand, we have the stimulant drugs like cocaine, amphetamine. It usually used by snoring, intravenous injection. It lead to brief or high euphoria, increase energy and concentration. If stopped, it lead to depression, tiredness, and sometimes psychosis. It have to be treated mainly psychological dependence, and it usually have to psychological psychotherapy because there is no specific antidote for this hallucination drug, for this stimulant drug. The same as hallucinogens, these drugs making usually leading to stimulation, hyperactivity, and at the same time into induce hallucination. Hallucination which is visual, tactile, or any sensory organ hallucination. It's usually associated with ecstasy, very high pleasure, and the problem is usually associated with them with leading to flashback, psychosis, and can be leading to fatal death and dehydration. Usually also we have no antidote for these hallucinogens, and should be treated psychologically and mainly psychotherapy and treatment. Cannabis, also an active product, is tetrahydrocannabinol. It's usually taken by smoking or oral. Usually we have euphoria, relaxation, hallucination, increase the appetite and temperature. If stoppage, we have also bad or hazardous using of this cannabis. Bad uses is conjunctival irritation, lung will be infected, flashback, schizophrenia, anhedonia, and amotivational syndrome, depression. All these are bad effects for using for cannabis, and even if people using cannabis for long period, they could develop psychosis and schizophrenia-like symptoms. Other depressive drugs like alcohol, if withdrawal of alcohol, it leads to depression and anxiety, poor appetite, poor concentration, insomnia, restlessness, and for chronic use, also depression and depressive symptom is present. For opiate, if using large dose or intoxication, we have low energy, low appetite, and poor concentration. If stoppage or withdrawal symptom, we have depressed mood, fatigability, insomnia, irritability, maybe we have diarrhea and flu-like symptoms. And also the chronic use lead to depression and depressive symptom. Cocaine, which leading to intoxication into it is a stimulant, and so it leads in intoxication in anxiety, low appetite, insomnia, paranoid behavior, and if stop lead to depression, increase of sleep, inability to take food, and loss of interest in everything, and leading to depression. We have just discussed cannabis and non-sedative substance. Every substance have specific mechanism of action, as we say before, and there is in this table we have just collection again. The mechanism of action in the first column, the route of administration is with taking oral or smoking and so on, and the effect is it inhibitory or stimulant, sedative or stimulant for taking the drug, and the main manifestation usually present in the eye if you are interested to know in. Substance is usually present for the variant period in the urine and the blood. Usually we screen the substance in the urine because urine taking long period and will be present more accurate for taking to know that the people are taking or not. For example, alcohol is present in blood for 7 to 10 hours, and in urine is 10 to 13 hours. Marijuana may be present in for 10 days for occasional user, and maybe for 45 days or 2 months in chronic user of marijuana may continue present a positive result even they stop use marijuana, which is cannabis and hashish, bango, and so on. Cocaine is present in urine for 2 to 4 days even after stop taking cocaine. Amphetamine also present for 2 days or even stopped after the stop of the drugs. This is an important slide because it gives you signs for drug intoxication. Sometimes you face people in ER, they came in coma, for example, they don't speak, they cannot give you enough information about which type of drugs they take, but just you know that they taking a drug. First, you have to see 3 main items to assess them: eye, vital signs, and neurological signs. For sedative drugs and hypnotic drugs and alcohol, also you will see in the eye nystagmus, miosis, which may be severe, and vital sign will be decrease and will be stage dependent. In chronic user, increased blood pressure, but in acute user will be find everything is dropped. Neurological manifestation in coordination of unsteady gait and slurred speech. You will feel staggering gait, and slurred speech will be very specific for these people. Stimulant will find in eye mydriasis, which is widening of the eye, of the pupil. Even they could wear a protective glass, sunglass in dark places because they cannot bear the light and the light effect. Increase vital signs will be mostly increase heart rate and blood pressure will be increased, arrhythmia, neurological manifestation, dystonia, and muscle weakness and seizure. Opiate, you will find meiosis, pinpoint pupil, vital sign, bradycardia, risk of respiratory depression and pulmonary, slurred speech, and for cannabis, you will find injected conjunctiva and tachycardia. As we say, addiction is not only an addictive drug, so DSM-5 also include a chapter for gambling disorder, which is playing a gambling game, and a way of addictive drugs, also internet gaming as a way of addiction drug, and PlayStation gaming and so on. All these PUBG gaming, these are being in addictive drug. If we're taking substance one by one, alcohol, as we say, it is the most widely used drugs all over the world. It is a central depressant substance, it's sedative and hypnotic drug. At low dose, it associated with excitation or disinhibition due to release of inhibitory effect for depression of the brain, and at high dose will be sedating and leading to sleep. Example like beers, wines, and hard liquid. Other sedative and hypnotic drug and anxiolytic, these are usually not selective general depressant on CNS. It can lead to reduced metabolism of various tissue of the body, and depending to the dose and the duration of action, we have sometimes sedative, which lead to decrease anxiety, tranquilizer to relieve anxiety, hypnotic to induce the sleep, and anesthesia to eliminate the pain. Sedative and hypnotic are medical drugs used for anxiety, depression, and anti-epileptic and muscle relaxant. We have barbiturate, we have non-barbiturate substance, we have tranquilizer, diazepam, hydrochlor. Cannabis or tetrahydrocannabinol, it is an active agent for marijuana. It changes perception, concentration, emotion, behaviors, and the mechanism of action usually affecting the sensory part of the brain. Used medically to relieve nausea and side effect of chemotherapy in cancer patient and glaucoma. It can be example for this marijuana, hashish, bango, and all the same but different in concentration of tetrahydrocannabinol. Nicotine. Nicotine is smoking. It's present in tobacco. It's a central nervous system stimulant, and nicotine is an excitatory amino acid and responsible for excitation. It's present in cigarette, in smokeless tobacco, and so on. Cocaine is usually obtained from coca leaves, and coca leaves is central nervous system stimulant and stimulates sympathetic nervous system activity of cardiac and muscle and gland. It produces bronchodilator in the lung. It used medically for topical anesthesia and surgical operations. It's like anesthetics. We have cocaine hydrochloride powder. We have cocaine alkaloid. All these are different way of use. Amphetamine are stimulant also, and they are closely used for stimulant CNS. It leading to different. Sometimes it medically used for attention deficit hyperactivity, in narcolepsy, and sometimes in depression. These lead to increased mood and improved mood. We have amphetamine, which taken orally or injection, methamphetamine, is a common used medically, dextroamphetamine, and noramphetamine, which is Ritalin, and so which is used in attention deficit hyperactivity and depression, as we say. Hallucinogens, these drugs, is the main action is to induce hallucination and stimulation. The people using these drugs leading to perception changes, sensory changes, thinking or self-awareness and emotion. Example, LSD and mescaline and pilocarpine, all these, and NIMDA, all these are hallucinogens, the drugs that leading to hallucination and stimulant. Inhalant, these are chemical substance produced by psychoactive vapors, and although its makeup is present in every home, it is used for anesthetics and leading to feel drowsy and feeling good, relaxed. At low dose, slightly stimulant, and at high dose, increase, leading to manifestation which could affect the heart of the patient due to dilatation of blood vessel and increase blood supply to the heart. Example solvent, model airplay glue, nail polisher remover, lighter, gasoline, aerosols or hairspray, paints, and some anesthetic. Nitrous oxide is very common, and amyl nitrite is also substance that is important for this. Opiate, and it is an analgesics, and it is very common substance and very widespread. It is usually present, some of this natural, some is synthetic, morphine, and derived from opium, and they have analgesics, so relieves of the pain. The medical use for analgesia, sometimes using for cough relief, antitussive used for diarrhea, and methadone used for treatment of narcotic or substance. One of the most addictive substances is heroin, usually injected, smoked, or inhaled. Codeine, usually injected or orally, and this taking in antitussive. Morphine, and synthetic opiate, methadone, and so they can be taken to treat for substance use in many patients. Phencyclidine and similar psychostimulant drugs, they are functioning, alerting new cortex, and they have been called dissociative anesthetics, which making people to be dissociative from the reality, and it developed in 1950 as anesthetics, but frequently it's taken off from market because it leading to hallucination in some of people. So some people using these drugs and is illegally using this drug for embolizing agent. It's like angry dust, love dust, and so on. This drug is hallucinating drug. Take home message, and this is last slide for me. Addiction could be as for substance, could be for behavior. Addiction is public health problem affecting the community. Biological and social factors play a role in drug dependence. Each substance have specific mechanism of action, dependence, symptoms, and withdrawal symptom. I know the lecture is long, but it is very important to know all the drug by drug, because you may face this drug, you may face all these items. So it is very important to know what is the etiology, so what is the general causes for all drug, general picture for all drug, and the specific picture for each drug. Thank you and goodbye.